Imagine believing that the only way to discover diabetes is through a blood test. You go to your doctor, they draw your blood, the results come back, and only then do you find out something is wrong. That's what most people think. But what if your body has been trying to warn you long before that moment, and you simply didn't know how to listen? What if the earliest signs of diabetes are already visible right now without any lab test at all? And what if those signs are not hidden deep inside your body, but right in front of you every single day? Your feet. It sounds almost too simple to be true, but over years of clinical practice, one pattern keeps repeating itself. Patients walk into the clinic believing they are healthy. They feel fine, no major symptoms,
So
no
tell
reason
me,
to
how
worry.
have you been feeling
And
since
yet,
we
when
adjusted the
asked a
medication
simple
last
question,
month?
have you
Better,
noticed
doctor.
anything
The
unusual about
headaches are
your
less
feet?
frequent.
The story begins to change.
I've been trying to keep track
Let me
of the
tell you about
symptoms like
one
you
case.
asked.
A
But
6,
honestly, the
7-year-old
fatigue is the
man
hardest
came
part to
in for
manage
what he
right
thought
now.
was a routine checkup. He lived a relatively healthy lifestyle. He wasn't
My feet feel
overweight.
numb.
He didn't feel sick. In his mind, there was no reason to
When we
suspect
connect these
anything
symptoms,
serious.
particularly the inflammation
Before
markers,
ordering
it
any
suggests
tests,
we're looking at
I
rheumatoid
asked him one
arthritis.
question.
It's
How
manageable,
are your feet?
but we need a clear
He
plan.
paused for a moment and said, well, they've been a little numb lately. Sometimes they tingle, but I thought that was just age. That one sentence changed everything. Because when we looked closer, he wasn't experiencing just one sign. He had four. Four
Based
clear
on the
warning
tests, it
signals
is
his body had been
diabetes.
sending
But
for
we have a
months,
clear plan
possibly
to manage
years.
it, starting with
Signals
this
he had explained
information.
away,
I understand,
ignored,
doctor. Thank
or
you.
simply never connected to anything serious. When his blood test came back, his fasting glucose level was over 200. He had diabetes. And he had likely been living with it, unknowingly, for more than 2 years. This is not a rare story. It happens every single day. Millions of people are walking around right now with elevated blood sugar, completely unaware, while their bodies quietly send signals they don't recognize. Not because they don't care, but because no one ever showed them what to look for. And here is the part that matters most. Your body does not stay silent when something is wrong. It communicates constantly. The problem is, those signals don't always come in the form of
I'm
pain
fine,
or
just a
obvious
little tickle.
illness. Sometimes they show up as small, seemingly
The body
harmless
communicates
changes,
before
changes that are
disease is
easy to
diagnosed.
ignore.
We can
A little
visualize
numbness,
these signals using
a
advanced
strange
medical
tingling,
concept art.
a patch of dry skin, a sensation that comes and goes. And because these symptoms feel minor, they are dismissed. It's just age. I slept wrong. I've been on my feet too long. But what if those explanations are wrong?
I understand
What if your feet are not just reacting to daily life,
your
but
recovery
trying to
should
tell
be
you something
straightforward.
much more
We
important?
just need to monitor
Because
your
the truth
progress
is this.
closely.
The first
Long
place,
before
diabetes
shows
speaks
up
up.
on a lab report, it begins affecting your nerves, your circulation, and your tissues. And one of the very first places those changes appear is in your feet. Not loudly, not dramatically, but quietly, consistently. If you know what to look for, the signs are there. And once you understand them, you will never look at your feet the same way again. Let's begin with the first sign, one that almost everyone has experienced at some point, and almost everyone has ignored. That tingling sensation in your feet, that pins and needles feeling. Most people describe it the same way. My foot just fell asleep. Maybe you were sitting too long. Maybe you crossed your legs. And in many cases, that explanation is completely normal.
The peripheral neuropathy
But here's the question you need to ask
affects these
yourself.
smaller nerves in the foot.
And
Is
that's
it
why I'm
happening
feeling this
often
numbness.
without a
Exactly.
clear reason? Because when that sensation becomes frequent, when it shows up randomly, repeatedly, and without any obvious trigger, it may be
High
something much
glucose
more
levels
serious.
cause the protective
This is what
myelin
doctors
sheath
call
to slowly
peripheral
erode,
neuropathy,
exposing the vulnerable
and it
nerve
is one of the
axon
earliest
beneath.
and most common signs of elevated blood sugar. To understand what's happening, think of your nerves like electrical wires. Each nerve is responsible for carrying signals between your brain and your body, telling you what you feel, how you move, and how your body responds to the world around you. But just like electrical wires, nerves have a protective outer layer. When blood sugar levels stay high over time, that protective layer begins to break down. Slowly, silently, almost like acid eating through
The
insulation.
sensory neurons are
At
highlighted
first,
in blue.
the nerve
When I
still
stimulate
works,
this
but not
pathway,
perfectly.
the electrical pulse
signals
reaches the
become
cortex
distorted.
in milliseconds,
Instead of
as
clear
shown here.
communication, you get interference. And that interference is what you feel as tingling, as numbness, as that strange pins and needles sensation that comes and goes. The danger is not just the feeling itself, it's what it represents. Because this damage doesn't happen overnight. It builds gradually, often for months or even years before a diagnosis is made. By the time you notice it consistently, your nerves have already been under stress for a long time. And here's what makes it even more concerning. Many people ignore it. They explain it away. They adapt to it. But nerve damage, once it progresses, becomes much harder to reverse. That's why this early stage matters so much. The good news? There are simple things you can start doing immediately to protect your nerves. The first is movement. A daily walk, just 20 to 30 minutes, can significantly improve blood flow to your feet. It helps deliver oxygen and nutrients to your nerves, supporting their function and slowing further damage. Not intense exercise, just consistent movement.
Oxygen and nutrients are delivered directly to the nerve endings, restoring function and allowing the signals to fire clearly once again.
Over time, those repeated spikes are what drive the damage forward. By cutting back on sugary drinks, processed foods,
the tingling
and
you're
excess
experiencing
carbohydrates,
isn't random.
you reduce that
It
burden
is your
directly.
body sending a
Small
clear
changes,
message, and we
but
need to
powerful
listen to
impact. Because that tingling sensation is not random. It's a message. And the sooner you listen, the more control you have over what happens next. Now let's move to the second sign, one that many people describe as far more uncomfortable and often far more frightening. A burning sensation in the feet. Not during the day, but at night, you lie down, trying to relax, trying to sleep, and suddenly your feet feel like they are on fire. There's no heat source, nothing touching your skin. And yet, the sensation is intense, persistent, and hard to ignore. Most people explain it away. It's just fatigue. I've been on my feet all day. Maybe it's the weather.
Feet at night,
and sometimes that's
serious.
true. But when this burning feeling shows up regularly, especially at night when your body is at rest, it may be a clear, early sign of nerve damage. Here's what's actually happening. When blood sugar remains elevated over time, it begins to damage the nerves in your feet. But instead of simply going numb, some of these nerves become unstable. They start sending incorrect signals to your brain. In other words, your nerves begin to misfire. Think of it like a fire alarm with a faulty sensor. There is no fire in the building. Nothing is burning, but the alarm keeps going off anyway, loud, urgent, impossible to ignore. That's exactly what your nervous system is doing. Your brain receives a message that says heat or burning, even though nothing is actually causing that sensation externally. The signal is coming from damaged nerve tissue itself. And because this often happens at night, when there are no distractions, it feels even more intense.
Based on these notes
You're
and the
left
burning
alone with the
sensation you're
sensation.
experiencing,
And that's
it
why so
appears
many
you may
people
have
find it
early
distressing.
diabetes.
But this isn't just about
Over time,
discomfort.
these
It's
glucose
about what
particles
this symptom
accumulate,
represents.
causing inflammation
Because burning
and
pain
irreversible
in the feet
nerve
is often
damage.
one of the earliest signs that your nerves are under stress from high blood sugar. In many cases, it can appear months or even years before a formal diagnosis of diabetes. That means your body has been trying to warn you, long before any lab result confirms it. The good news is, there are simple steps you can take right now to reduce that stress on your nerves. The first is hydration. Drinking enough water, at least 6 to 8 glasses a day, helps your body regulate blood sugar levels more effectively and supports your kidneys in clearing excess glucose from your bloodstream. It may seem basic, but it makes a real difference. The second is increasing fiber in your diet. Foods like vegetables, beans, lentils, and oats slow down how quickly sugar enters your bloodstream. Instead of sharp spikes, your blood sugar rises more gradually, and that reduces the stress placed on your nerves. Less stress, less damage, better control. Because that burning sensation is not random. It's not just tired feet.
Listen
It's a signal.
before it gets
And once you understand what it
worse.
means,
And
you have
more
the
often.
power to respond before it becomes something more serious. Now let's talk about the third sign, and this is where things stop being uncomfortable and start becoming genuinely dangerous. A small wound that doesn't heal. At first, it seems harmless. A blister from a tight shoe, small cut you barely noticed. A crack in the skin that you assume will close on its own. And in most healthy situations, it would. Your body is designed to heal, but when blood sugar remains elevated over time, that healing process begins to break down. Slowly, silently. Here's what's happening beneath the surface. High blood sugar damages your blood vessels, especially the tiny ones in your feet. These vessels are responsible for delivering oxygen, nutrients, and immune cells to areas that need repair. When they become narrowed and stiff, that delivery system no longer works properly. Think of it like trying to water a garden with a hose that's bent and restricted. The water is there, but it can't reach where it's needed. Your body still has everything required to heal the wound, but it simply can't get those resources to the site fast enough. So the wound stays open, vulnerable, unprotected. Now let me give you a real-world example. A patient once came in and said, "I had a small blister from my shoe about 3 weeks ago. It hasn't gone away." 3 weeks. That's far longer than a normal healing time for something so minor. When we examined it, that small blister had already begun to develop into something more serious. The surrounding skin was inflamed, and the tissue underneath was not repairing the way it should. This is how it begins. Not with a major injury, but with something small that gets ignored. And here's the part you need to understand. An open wound that doesn't heal is not just a surface problem. It's a doorway. A doorway for bacteria to enter.
It's crucial
a doorway
to
for
understand
infection
that if
to take
these small
hold.
wounds are neglected,
And in a foot with
they can
poor
rapidly
circulation,
progress into
that
the
infection
severe
can spread
ulcers you see
quickly
here.
and become extremely difficult
We use
to
the
control.
monofilament to test
This
the
is why
sensation.
diabetic foot
You have
ulcers
some
are one of the
numbness,
leading
and this
causes of
callus
lower
shows
limb
high pressure.
amputations
No
worldwide.
pulse, continue
Not
compressions.
because of
I
a
need
single
central
major
line now.
injury,
Central line
but
ready.
because of a
Vitals
small
are crashing.
wound that didn't heal and wasn't taken seriously early enough. That's why this sign matters so much. The good news is you can take simple steps to protect yourself. Start with awareness. Every day, especially after a shower, take a moment to check your feet. Look carefully at the soles, the heels, and between your toes. You're not looking for something dramatic. You're looking for anything that shouldn't be there. A cut, a blister, a crack. If you find something, act immediately. Clean the area gently with mild soap and water. Apply an antiseptic.
All right, that's all
Cover
set.
it with a
You did
clean
great. We'll
bandage
have you
to
checked out
protect it
shortly.
from further irritation. And most importantly, watch it. If there is no clear improvement within 48 hours, don't wait. Seek medical advice. Because when it comes to wounds and
If
high
you
blood
experience
sugar,
any
time
issues,
matters.
or if
The
there's
earlier
no
you act,
improvement,
the easier
please
it is
don't
to prevent
hesitate to
something
call this
small
number.
from becoming something serious. Because sometimes
First,
the
gently
difference between
exfoliate
healing
with a
and
pumice
harm
stone.
starts with a
Next,
single
apply a
blister
generous
that was
amount of
ignored.
moisturizing cream.
Now let's look at the fourth sign, one that is often right in front of you, yet almost always overlooked. Changes in the color of your skin, especially around your
When
feet
infection
and ankles.
strikes,
At
early
first
immune
glance,
response
it
is
may
critical.
not seem important.
Here,
You might
macrophage
notice that the
rapidly
skin
clears
looks
the
slightly darker than before, or maybe it appears more reddish, even slightly bluish in certain areas. And like most people, you explain it away. It's just aging. Maybe it's sun exposure.
Time matters.
I've always had
when
darker
healing
skin there.
slows.
But when these changes appear gradually and persist over time, they may be telling a different story. They may be a sign that your tissues are not receiving enough oxygen.
Here
And that
we see
brings
the
us back to
characteristic
circulation.
darkening of the skin.
Your blood is responsible
leading
for
to sign
delivering
number
oxygen
4.
and nutrients to every part of your body. And your feet, being the farthest point from your heart, are at the end of that delivery route. Think of your bloodstream as a delivery system, a network of roads carrying essential supplies to every cell. Now imagine those roads becoming narrower and less efficient over time. Traffic slows down, deliveries are delayed, and in some areas, they stop arriving altogether. That's what happens when high blood sugar begins to damage your blood vessels. The vessels that supply your lower
That's a fair
legs and
instruction.
feet become stiff
As you can
and
see on the
restricted.
scan, the blue
As a
areas
result,
indicate a lack
less
of oxygen reaching
oxygen-rich
the
blood
tissue.
reaches
This is
the
causing the
skin.
numbness.
And
Will
when
the
tissue
treat-
doesn't receive enough oxygen, it changes. The color shifts. Sometimes darker, sometimes reddish, sometimes with a bluish tone that signals poor circulation. This is not just a cosmetic issue. It's a visible signal that your tissues are under stress. that they are not being nourished the way they should be. In some cases, the skin may also become thinner, more fragile, and more prone to injury because without proper blood flow, the body cannot maintain healthy tissue structure. What makes this sign especially important is that it often appears early, long before more serious complications develop. It doesn't cause pain, it doesn't interrupt your day, but it is there quietly indicating that something deeper is changing inside your body. And the more you understand it, the easier it becomes to respond early. Simple habits can help support circulation.
As you can see
Even
right
small
here,
movements
these
like
color
ankle
changes are
rotations,
often
toe
the
raises,
earliest
or
clues
short
we
walks
have.
can
So it's
encourage
good you
blood
came
flow
in.
back into your feet.
Yes.
Elevating your legs slightly when resting can also improve circulation, because your body is always communicating. And sometimes, the message is as simple as a change in color, waiting for you to notice. Now let's move to the fifth sign, one that many people see every day and rarely take seriously. Cracked heels. For most people, this seems like nothing more than dry skin. It's common, especially in colder weather. You apply lotion, maybe use a foot cream, and expect it to improve. But what if it doesn't? What if the cracks keep coming back, no matter how much you moisturize? What if they appear even in warm weather, when dryness shouldn't be an issue? At that point, it may no longer be just a skin problem. It may be a nerve problem. This is where something called autonomic neuropathy comes into play. Unlike the nerves that control movement or sensation, autonomic nerves control automatic functions in your body, things you don't have to think about. One of those functions is regulating moisture in your skin. Your sweat glands play a key role in keeping your skin naturally hydrated from the inside. But when blood sugar remains elevated over time, these autonomic nerves can become damaged. And when they do, your sweat glands stop working properly. Your feet begin to lose moisture not from the outside, but from within. Think of your skin like a wall built to protect what's inside your body. When everything is working properly, that wall stays strong and sealed. But when internal moisture is lost, the structure weakens. Small cracks begin to form. And over time, those cracks deepen. This is why no amount of lotion seems to fully fix the problem. Because you are treating the surface while the root cause is happening underneath. And here's why this matters. Those cracks are not just cosmetic. They are openings. Openings where bacteria can enter. Openings where infection can begin. And when circulation is already compromised, even a
Autonomic
small
neuropathy is a
infection
condition
can
that
escalate
many people
quickly.
don't know they have.
That's why
It
persistent
occurs when
heel
the nerves
cracking
that
should
manage
never be
involuntary
ignored,
functions are
especially if it's
damaged.
severe, painful, or not improving over time. The good news is there are simple habits that can help protect your feet. First, moisturize your feet daily, especially before bed. Use a thick, high-quality cream or natural oils like coconut oil to help support the skin barrier. But avoid applying moisturizer between your toes. Excess moisture in that area can create the perfect environment for fungal infections. Second, stay hydrated. Drinking enough water helps support your skin from the inside, improving its ability to maintain moisture naturally. Because healthy skin is not just about what you apply externally. It's about what your body can maintain internally. And when your heels start to crack repeatedly, it may be more than dryness. It may be your body asking for attention before a small problem becomes something much bigger. Now let's move to the sixth sign, one that many people notice, but rarely connect to something deeper. Swelling in the feet and ankles. At the end of a long day, a little swelling can feel normal. Maybe you've been standing too long, maybe you've been sitting for hours. Your shoes feel tighter, your socks leave marks, and you assume it's just part of daily
When
life.
moisturizing your
And
feet,
sometimes
ensure you
it
apply
is.
the cream
But when
everywhere
that
except
swelling
between the
becomes
toes.
consistent when your
Avoid
feet
this
or ankles
area.
look puffy every evening, or when pressing your finger into the skin leaves an indentation that stays for a few seconds, that's a different situation. That's called edema. And it can be a sign that your body is struggling to manage fluid balance. Here's where it connects to blood sugar. Over time, high blood sugar doesn't just affect nerves and blood vessels, it also affects your kidneys. Your kidneys act as your body's filtration system. Every drop of blood passes through them, where waste is removed and fluid levels are carefully regulated. But when blood sugar remains elevated for long periods, it begins to damage those delicate filtering units. And when the kidneys are not working efficiently, fluid starts to build up. Think of it like a drainage system that's slowly becoming blocked. The water is still flowing, but not as smoothly as it should. Eventually, it begins to back up. And because of gravity, that excess fluid settles in the lowest parts of your body, your feet and ankles. That's why swelling often appears there first. It's not just about being tired. It's about your body holding onto fluid it can't properly process. And here's why this matters.
When assessing
Edema
the
is not
ankles, we
just a
look for this
cosmetic issue.
indentation,
It's
known
a
as
signal,
pitting edema,
a
which is
signal
our
that
sixth
your
sign.
internal filtration system may be under stress. A signal that your circulation and kidney function may not be working as efficiently as they should. The good news is, there are simple habits that can help reduce this burden. First, reduce your sodium intake. Salt causes your body to retain water. The more sodium in your diet, the more fluid your body holds on to, making swelling worse. Pay attention to processed foods, canned
When I press
items,
here, you can see
and
the indentation
packaged
remains.
snacks,
This is
as
called
they
pitting
often
edema,
contain
and it
hidden
indicates
sodium.
significant fluid buildup.
Second,
We
elevate
need to
your
address
feet
this
when you
immediately.
rest. Even placing your feet slightly above heart level using a pillow can help fluid move back toward the center of your body, reducing pressure and swelling in your lower extremities. Small changes, but meaningful results. Because swelling is not just
As
about
filtration
comfort.
slows,
It's
excess
about
fluid begins
understanding
to
what your
leak from the
body is trying to
capillaries
tell
into
you
the
and
interstitial
responding
space,
before that
resulting
signal
in
turns
edema.
into something more serious. Now let's talk about the seventh sign, one that is often misunderstood, misdiagnosed, and quietly masked for months or even years. Pain in the feet, but not the kind of pain you might expect. Many people, especially as they get older, assume that foot pain is simply arthritis, joint stiffness, or the result of years of wear and tear. They take pain relievers,
Notice the difference
rest
in the
a little
recoil.
more, and
on
move
the left,
on.
the skin
And
immediately
sometimes
rebounds.
that
But on the
assumption is
right, the
correct.
persistent
But
edema shows
sometimes
clear.
When the
it's
kidneys
not.
are under stress,
Because
they
when
struggle
this
to
pain is
remove
caused
excess
by
sodium
nerve
and water,
damage, the
which
source
causes the
is
swelling you
completely
see in your
different.
ankles.
This is known as neuropathic pain, and it behaves very differently from typical muscle or joint pain. Patients often describe it in ways that stand out immediately. A sharp, stabbing sensation, a sudden electric shock, a burning or needle-like pain that appears without warning, often at night when everything is quiet. And here's what makes it confusing. There is no injury, no swelling, no visible cause. That's because the pain is not coming from damaged tissue, it's coming from damaged nerves. When blood sugar remains elevated over time, it begins to interfere with how nerves function. Instead of transmitting signals correctly, those nerves become unstable. They start sending false signals to your brain. Think of it like a car alarm that's been damaged. No one is touching the car. Nothing is happening. And yet, the alarm
Persistent
suddenly
swelling
goes
can be a
off,
sign of an
loud,
underlying
intense,
condition.
and completely
Please,
unnecessary.
make sure you mention
That's
any
exactly
ongoing
what a
swelling to your
damaged
doctor.
nerve does. It sends an urgent pain signal, even when there is no real physical threat. And because the signal feels real, the pain feels real. But treating it like regular pain by taking anti-inflammatory medication or ignoring it does not address the root cause. It only masks the warning, and that's the risk. Because while the pain is being covered up, the underlying nerve damage continues to progress. The good news is, there are simple ways to support your nerves and
Don't
reduce this
ignore
type of
edema.
discomfort. Start with gentle movement. Before you even get out of bed in the morning, take a few minutes to stretch your feet and ankles. Flex your toes, rotate your
there's that
ankles, and
familiar
gently
ache.
activate
It's
circulation.
the arthritis.
This helps
I tell
wake
ya.
up the nerves
It
and
just
improve
gets
blood
worse
flow
every
before you put
year.
weight on your feet. At night, consider a light foot massage. Using slow, circular motions along the sole of your foot and up toward the ankle can help relax the nerves, improve circulation, and reduce the intensity of those misfiring signals. These are small habits, but they make a difference. Because when it comes to nerve pain, the goal is not just to silence the signal.
As you
It's
can
to
see here on the
understand it
diagram,
and support
the
your
pain
body
occurs
before
when
the
these
damage
specific
goes
nerve
further.
fibers are
Now let's
damaged or
move to the
dysfunctional.
eighth sign,
Right,
one
that
that
makes sense
many
now.
people have experienced for years, but rarely question. Cold feet. At first, it seems harmless. Some people even joke about it. I've always had cold feet. I just need thicker socks. It's normal in winter, and in many cases that's true. But when your feet feel cold all the time, even in warm weather, even under blankets, even when the rest of your body feels perfectly fine, that's no longer just a comfort issue. That's a circulation issue. Your feet rely on a steady flow of warm, oxygen-rich blood to maintain normal temperature. When that flow is reduced, your feet begin to feel cold, not because of the environment, but because of what's happening inside your body. This is often linked to a condition called peripheral artery disease (PAD. Over time, high blood sugar can damage and narrow your blood vessels. The pathways that carry blood to your feet become tighter, less flexible, and less efficient. And when that happens, less warm blood reaches the farthest parts of your body. Think of your circulation like a heating system in a house. Your heart is the furnace, pumping warmth through a network of pipes, your blood vessels to every room. Now imagine those pipes becoming narrower or partially blocked. The heat is still being produced, but it can't reach the farthest rooms. So those rooms stay cold, no matter how high you turn up the heat. That's exactly what happens in your feet. They are at the end of the longest pipeline in your body. And when circulation is compromised, they are often the first place where you feel it. Cold feet are not just uncomfortable. They are a sign that your tissues may not be receiving enough oxygen and nutrients. And over
Nerve
time,
pain is a
this can
signal
affect
we must
healing,
understand,
nerve function,
not
and
just
overall
mute.
foot health. The good news is, circulation can often be supported with simple daily habits. The most effective one? Walking. A consistent, brisk walk, even just 20 to 30 minutes a day, helps push blood through your vessels, strengthens circulation, and encourages those pipes to stay open and flexible. If that feels like too much at first, start small. Even 10 minutes is enough to begin making a difference. Because movement is not just exercise. It's a way to restore flow.
The numbness
and
and
when your
cold you're
blood flows
experiencing
better,
is due to
your
reduced
feet
blood
stay
flow,
warmer
right
not
here in
just
the
on
lower
the surface,
extremities.
but
We need
deep
to
within
improve
the
that
tissues that
circulation.
depend on it. Now we come to the ninth and final sign, one that is incredibly easy to miss, yet deeply important once you understand what it means. Hair loss on your lower legs and feet. At first, this doesn't seem like a health issue at all. Most people don't even notice it. You might look down one day and realize the hair on your ankles or feet is thinner than it used to be or gone completely. And your first thought is simple. That's just aging. But in many cases, it's not. Because hair follicles are not just cosmetic features, they are living structures that depend on a steady supply of blood, oxygen, and nutrients to function properly.
So cold
And when
feet
that
can
supply
often
is
be a sign
reduced,
of
they
peripheral
stop
artery
growing.
disease, or
Think of your hair
PAD.
follicles
Is that
like small
serious?
It
plants
means your
in a
limbs
garden.
aren't getting enough
As
blood
long as
flow.
water and nutrients reach them, they grow normally. But if the irrigation system starts to fail, if less water reaches the soil, those plants
The
don't
thermal
die
overlay
overnight.
highlights the
They
vascular
simply
response
stop
to
growing,
exercise, with
quietly,
blood flow significantly
gradually,
increasing in the legs
until
and
one
feet.
day, they're no
Keep
longer
that pace
there.
steady, everyone. We're
That's
just getting
exactly
warmed
what
up.
happens when circulation
doing
is
great. Keep it up.
compromised by long-term elevated blood sugar. The tiny blood vessels that feed your lower legs and feet become damaged and restricted. Less oxygen reaches the hair follicles, and over time, they shut down.
Start
This
today,
makes hair loss a
not
visible marker
someday.
of something much deeper. Reduced blood flow. And what makes this sign especially dangerous is how often it is ignored. There's no pain, no discomfort, no urgency. Just a subtle change that most people never question. But your body is still communicating.
Well, look at that. It's
And
gone.
this may be one of the clearest visual signals that your circulation and possibly your blood sugar needs attention. So here's what I want you to do. Tonight, before you go to bed, take just 30 seconds. Sit down. Look at your feet. Look at your lower legs. Check the skin. Notice any changes in color, texture, or hair. Because awareness is the first step to prevention. And if you notice any of the signs
When I
we've
bet you
talked about,
vanquished us
even
to
one, don't
football.
ignore it.
This
Schedule
subtle
a simple
sigh
blood
is
sugar
often
test.
missed, but
It's
it
quick,
matters deeply.
it's affordable, and it can give you answers that may protect your health for years to come. You've worked hard for your independence, your mobility, your quality
Just
of
a small
life.
pinch.
Don't let something
your glucose
silent
level
take
is
that away
105.
just because no one told you what to look for.
Everything looks good.
Now you know.
Look at this
If this
part.
helped you,
Isn't that
take
funny?
a moment to share
Make
it
sure
with
you
someone
like
you
and
care
share it
about,
too.
a parent, a friend, a partner. You might help them see something they would have otherwise missed. And before you go, check your feet tonight. Because sometimes the smallest signs carry the biggest warnings.